The Physiology of Negative Pressure Wound Therapy, exploring the science behind vacuum-assisted closure. Welcome to today's podcast, where we delve into the fascinating science behind negative pressure wound therapy, commonly referred to by its brand name, vacuum-assisted closure. This therapy represents a remarkable intersection of mechanical engineering and biological healing, offering clinicians a potent tool to transform stubborn, chronic wounds into sites of active recovery. At its foundation, negative pressure wound therapy involves applying a controlled subatmospheric pressure to a wound via a sealed dressing. While this might initially sound like a mere mechanical intervention, the true therapeutic impact lies in the complex series of physiological reactions it initiates within the body. The core objectives of negative pressure wound therapy. There are several main goals for this therapy. First, it aims to foster wound healing. Second, it works to remove unwanted fluids and infectious substances. Third, it helps to reduce swelling in the tissue. Lastly, it prepares the wound for successful closure. Achieving these results relies on a blend of four crucial, interconnected physiological mechanisms, which are often categorized as macro and micro effects. The four pillars of physiological response. 1. Macrodeformation. Bringing the wound together. The most visible impact of negative pressure wound therapy is the way it physically draws the wound edges together. The therapy's suction force contracts the wound, reducing its surface area and depth. This mechanical process means less new tissue is needed to fill the wound, which can lead to quicker and more effective primary closure. The analogy here is simple. Imagine shrinking the wound from the outside inward, relieving stress on surrounding healthy tissue and supporting efficient healing. 2. Microdeformation. Stimulating cellular activity at a microscopic level. The foam dressing used in negative pressure wound therapy creates countless tiny pores under the influence of negative pressure. This environment gently pulls the wound surface upwards, generating a scaffold-like pattern of strain on individual cells such as fibroblasts, keratinocytes, and endothelial cells. This mechanical stimulation acts as a powerful signal, encouraging these cells to multiply and become more active. Much like the body's natural processes during wound repair, the clinical outcome is twofold. Granulation tissue production is accelerated, as fibroblasts divide more rapidly and create essential extracellular matrix components like collagen. Additionally, this micro-level stretching promotes the development of new blood vessels, a process known as angiogenesis, ensuring that the wound receives a robust supply of oxygen and nutrients. 3. Fluid removal and control of swelling. Another critical function of negative pressure wound therapy is the active extraction of excess fluid from the wound bed. By continuously or intermittently suctioning away this fluid, the therapy lowers pressure within the tissue spaces, which in turn enhances capillary blood flow and improves oxygen delivery to the wound's edges. Moreover, the therapy clears out harmful substances found in wound exudate, such as pro-inflammatory cytokines, enzymes that break down the tissue matrix, and bacteria. These compounds can significantly hinder healing if allowed to accumulate. By removing them, negative pressure wound therapy creates a cleaner, more supportive environment for tissue regeneration. 4. Stabilization of the wound environment. The sealed dressing also plays a vital role in maintaining a protected and moist wound bed. This hydration is essential for the migration and proliferation of healing cells. The occlusive drape acts as a barrier, shielding the wound from outside bacterial contamination and reducing the risk of cross-infection. There is ongoing debate about mild hypoxia within the sealed environment, which some believe may further stimulate new blood vessel formation. However, the benefits of improved blood flow due to reduced swelling tend to outweigh any potential drawbacks. A self-reinforcing cascade of healing. These four mechanisms do not act in isolation. Instead, they form a powerful, interconnected cycle that accelerates the healing process. The removal of fluids and reduction in swelling improves local blood flow and oxygenation, ensuring that nutrients and immune cells reach the wound while toxins are washed away. This favorable environment amplifies the micro-level signals that encourage cell proliferation and the formation of new tissue and blood vessels. Simultaneously, the mechanical action of pulling the wound edges together reduces the overall size of the injury, bringing healthy tissue closer to the center. All of this is supported by a stable, protected wound environment that safeguards the newly formed tissue as healing progresses. Clinical choices and best practices. Pressure settings for negative pressure wound therapy typically range from 75 to 125 mm of mercury. Lower pressures are ideal for more sensitive wounds or when working to protect delicate tissues, while higher pressures are reserved for wounds producing large volumes of fluid. Therapy can be delivered either continuously or intermittently. Continuous therapy is best suited for controlling fluid and stabilizing fragile tissue, such as in wounds located near major blood vessels. Intermittent therapy alternates between periods of suction and rest, which may provide additional mechanical stimulation and further enhance granulation tissue formation, though it can be more uncomfortable for some patients. When it comes to dressings, open-cell polyurethane foam is most commonly used for its ability to provide significant micro-level stimulation. Gauze is another option and may be less painful when removed. Conclusion: to summarize, negative pressure wound therapy is not simply about removing fluid from a wound. It is a sophisticated, biophysical intervention that mechanically prepares the wound bed, stimulates cellular growth, alters the biochemical environment by eliminating inhibitory substances, and physically protects the healing tissue. By understanding these integrated physiological principles, clinicians are better equipped to use negative pressure wound therapy to turn stagnant, chronic wounds into sites of vibrant, active healing. Thanks for tuning in. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.